Hi, my name is Nicola Hahn. I've been a dental hygienist for 22 years now. I am currently in the great state of Minnesota on the border of North Dakota, where I had grown up. But when I first practiced, I went to Colorado, and I practiced there for close to 11 years. I was lucky enough to work in 2 general practices. I owned a temp service, and then I was also able to work for a pediatric dentist. I helped the ADHA out for 10 years working as their secretary, and was very active in community involvement with their sealant program. With that, I was able to get another part-time job at Warren Air Force Base, which was in Cheyenne, Wyoming, only an hour north. And I was able to learn so much. I drove with the general from the area I was, and then we were able to go work with the Air Force cadets to make them more ready. There were dental hygiene students that were under my control that I was able to teach them and help them work on those cadets at the same time. So it was a collaboration between the Air Force Base and the local Laramie Community College. From there, also with the general practice, I was able to get certified and trained with the BioLase company right when lasers were first starting to come out. So I would go from offices in Denver and Northern Colorado to train them on how to use the laser. My biggest passion, though, was being a mom, and my first child was born with a genetic illness called cystic fibrosis. And so with that diagnosis, I took 9 months off. We moved back home to the state of Minnesota, where she could be seen at the Children's Hospital. And then just using my healthcare background, being able to take care of her, just let me know that I could still do part-time dentistry, which I'm currently doing, but also being able to take care of all of her needs. I was able to work with my grandparents at the same time. So just like being in a general office in dentistry, I had little children all the way to children in their 80s. And I'm really lucky and thankful for that opportunity. We also were able to adopt our second daughter 2 years after Logan was born. And so with that completion of our family, we decided also to homeschool. So I've also homeschooled the children for 7 years. And that's been a great passion. With the opportunity that was given to me with OHU, I've always looked for a college program that I wanted to complete. This was a perfect time during COVID. Also, with having a child that could not be out and about, still on some restrictions, taking in all of the knowledge that we have as hygienists over these years, taking in consideration all the continuing education we put into our work and also our individual passions was a huge draw for me. I wanted to teach my children that I can still do school, go to college, get a degree while being at home, furthering that love of education and knowledge. I do tell them all the time, as long as you're willing to learn, there's really no ceiling for you. So many times it's been a group and family effort, but I have to say the experience that I've had has been 100% positive. I've had students in my class from all over the world. There's things that I have learned that I honestly have not even thought about before as a practicing hygienist. And after 22 years, I thought I'd seen a lot considering the opportunities that I had available to me in my start of my career and even on to now. I'm currently working a school program that just allows me to be in schools, bringing in mobile dental equipment and working with a sealant program in the state of North Dakota. I would really like to see this program change a bit more like we had it in Colorado with more volunteer opportunities. And I can see now with this furthering of education, being able to work with the North Dakota Dental Foundation as this goes on and using that knowledge and now the new degree in the oral health promotion to really take the skills that I have, the work that I've done in the schools, and the work that they want to do in the great state of North Dakota as far as promoting oral health in children. So when I decided to go back to school and read about the requirements, I think a lot of people would look at the paper and wonder what they would write it on. And I want you to know it comes to you very naturally. The way the school is structured, the way they have you learn about writing, it's not anything that what you've expected. You learn so many things about yourself, about other people, about practicing dentistry still, about practicing dentistry in other capacities. And even though I thought I didn't practice full time, I definitely hadn't been practicing for the last 18 months. I did not know what I would be working with. I chose a research paper about what I knew best. And that really was my daughter and her oral health issues with her genetic illness. So even as each year passed, my comfort with being behind the dental chair but showing knowledge that could make a difference in someone's overall health is really exciting. And really, after I had my first daughter, who was born with cystic fibrosis, it was more apparent to me on how the body and the oral connection was so important. So many people have issues with respiratory diseases, not just her specific condition, and it's a contributing factor to their mouth breathing and all of their medications. So we can often see these symptoms before they even know they're having serious issues. And we also have the advantage of helping these patients avoid costs and problems, and we can help them learn more about their mouth and teach them these simple things. As I thought about my daughter and the observations I had, I thought how lucky I was to know the decalcified teeth and the oral tissues that were dry and glossy were not right. But I started thinking, how many of the patients with cystic fibrosis know this? How much do their practitioners know? How much is actually educated on the oral supplements they have to take, the other medications, the nebulized medications they have to take? There was just so much. And as we know in dentistry of the mouth-body connection, it really just made me reflect a lot on her journey, the journey with our doctors, the journey with being a mom at the same time as being a clinician. And it was really a good journey to be able to try some behavior change things that would help her in the long run, but also think of how could I help other kids like her, people like her, other patients that have similar respiratory issues, and the little things that could just be done with their motivation, and then let that health kind of continue on. So the paper, as I said, kind of comes to you, and from that you learn so much about yourself as you go through. I really enjoyed writing every bit of it, and I can be the first one to tell you I was not looking forward to writing anything. I am a science major. I swore to myself through and through. I love data and research, and seeing is believing, but I think I was taught a little bit more about how the art brain could come and work with my science brain. I'm really hoping that I continue to journal, as that was something that was really impactful. Even if I hadn't seen someone, I was taught to think about a patient, because with 22 years, I've definitely seen quite a few in different capacities. So the overall experience was amazing. I'm gonna miss my camaraderie of the people that I visited with every week, but I know that as we go forward, just with the alumni portion of the website, the way that the website is structured, the way that there's articles written that you get to still talk about and discuss, that this is a whole new family and a whole new opportunity to continue the passion I had when I first chose dentistry, is to help people help themselves. So thank you for listening.